you here for an appointment?
I am. Sorry, I'm a little bit late. I was at a spin yoga class, and then I had to stop and get a coffee. You know, that quadruple shot really gets my heart going.
Oh, nice. No worries. If you could just fill out this information here. I'm Alyssa. I'll be doing your cleaning today. And once you're finished with this, I'll get you back to the room, okay?
Okay, sounds good.
I'm glad to see you, Jane. Let's go over your health history, and I'll take your vitals, and then we can get started, okay?
Sounds good.
All right. I see that you're taking some medications for your high blood pressure. Can you tell me about that?
Yeah, heart disease runs in my family, and I found out I have high blood pressure, so I try to stay active. I just tried Aqua Pilates this week, and I'm taking Lipitor for my high blood pressure.
What? Aqua Pilates? That sounds like fun. Do you take any other medications?
I do. I take nitroglycerin when I have angina attack.
Can you tell me a little bit about your angina?
Yeah, I had my first attack a couple years ago, and it was at my Hula Fit class. It was really scary.
Oh,
And I thought I was having a heart attack. I went to the emergency room, but it turns out it was just angina. My doctor prescribed nitroglycerin, and he said to take it when I have an attack, and it usually does the trick. He said I have stable angina.
How often do your attacks? How often do you have angina attacks?
I'd say every couple of weeks.
What usually causes your attack?
Questions from dental hygienists, and then sometimes when I have a tough workout class or I've had a lot of coffee. I had that iced coffee earlier. Hopefully we're good.
That quadruple shot.
And then I have an attack. Whenever I have an attack, it's pretty uncomfortable.
I bet. So do you have your nitroglycerin tablets with you?
I do. I have my nitro.
Cool. I'll just set that right here. Put it out on the counter for the appointment.
Okay, sounds good.
Does rest also help you to relieve the pain when you are having an attack?
Yes, it does. I'm thinking of joining a yoga studio because I've never had an attack while I'm doing yoga moves. I guess it's because it's so relaxing.
Yes, I like yoga too. Well, it sounds like you haven't had an attack in a while.
If only I could just get my blood pressure down.
Well, yoga should help with that. I see you don't have any allergies. Let's take your pulse and your blood pressure now.
Yeah. Ah.
And can you uncross your legs for me too?
I have achy pain in my chest that's radiating to my shoulder.
That's not good.
Oh.
Look at the blood pressure and see what's going on, okay?
My neck and my arm are bothering me too.
So your pulse was a little high. We're going to get your blood pressure for you, okay? And see how that goes.
Oh, my arm and my chest.
Well, Jane, your blood pressure is actually really high today. I'll be right back. I'm going to go get my faculty right now, okay?
Sounds good.
Have an emergency.
Oh, my chest and my neck and jaw.
Oh, what's going on? Alyssa, can you tell me about your patient?
Yeah, so this is Jane. She's a 40-year-old female, ASA 3.
Okay.
She has a history of stable angina, and she was starting to feel ill while I was taking her vitals. Her pulse and blood pressure were really elevated.
Okay, yeah, that doesn't sound good. Based on your history of angina and your symptoms, I'd like you to go ahead and take one of your nitroglycerin tablets now. In the meantime, Alyssa's gonna take care of you. Alyssa, can you monitor Jane's vitals? And she'll be taking the nitroglycerin and putting it under her tongue. And I'm gonna go get Mrs. Taylor to bring some oxygen. And when the oxygen gets here, Alyssa, can you set it at 4 liters per minute?
Yes.
Okay, I hope you feel better soon. I hope that nitroglycerin helps. We'll be back to check on you. And Alyssa will take great care of you.
Alright, let me just jot down that time that you took that nitro, okay? And then I'll be monitoring your vitals. You okay?
Super.
Here's the oxygen, Alyssa.
Thank you.
You're welcome. What's going on, Jane? Are you feeling okay? Are you feeling a little better since Dr. Ross told me you might be having an angina attack and you took some nitroglycerin?
I've been better. I feel the same. I think I need more nitroglycerin, like all of the nitroglycerin.
Well, not all. We only can give you one dose every 5 minutes. Has it been 5 minutes, Alyssa?
Yes, it's been 5 minutes. I'm going to
Okay.
check her vitals now.
Okay, sounds good. And since you're still not feeling well, I'd like you to take one more nitroglycerin tablet, please. Okay. And I'll come back and check on you in about 5 minutes, okay? 5 minutes later. Okay, Jane, how's your pain level right now?
The nitroglycerin isn't really helping that much. My chest still really hurts.
Okay, yeah. Dr. Ross wanted to go ahead. We contacted the EMS, and I also brought you an aspirin tablet for you to chew. Thank you. And then, so EMS will be here soon, and we're going to go ahead and take her vitals one more time before EMS gets here.
Okay.
Okay, and take one more nitroglycerin tablet. Okay, we'll take care of you.
Okay, thanks for taking care of me. Hopefully I can make it to my paddleboarding class.
I sure hope so.
Our patient today has stable angina and experienced an angina attack. Her attack was precipitated by recent exercise and caffeine. We initiated code blue to get the supervising DDS. Other precipitating factors for angina attack include a hot and humid environment, cold weather, cold foods, stress, and high altitude.
Stable angina is an ASA 3. There are two other forms of angina, unstable and variant. Unstable angina is a high risk for myocardial infarction and an ASA 4, so we would not treat that patient in the CCD clinic. In contrast, the other form of angina, variant angina, has a low risk for coronary artery disease, and nitroglycerin provides relief. We would see the patient with variant angina.
The angina attack would be recorded in the patient chart and would include the precipitating factors, the patient's vitals, the medication doses and times, and details of the intervention.